This is Troy, your virtual host. We are live and recording.
Okay. Thank you. Would everybody rise for the Pledge of Allegiance, please? I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Mr. Pratt, would you please certify or not certify the agenda, depending on the mood you're in?
Good afternoon, board members. All of the items on the agenda for today have been reviewed by our office and meet legal approval.
Okay, thank you. Do we have any member disclosures for any items on the agenda this month?
No, sir.
I have none, Mr. President. Thank you.
None.
There you go, Donnie. There. Okay. Thank you.
Okay, I have none either, and I'm hearing there are no agenda items this month. We have the consent agenda, which is the approval of the minutes. Has everybody had an opportunity to review the minutes?
Yes, sir.
Are there any revisions to the minutes that anybody would like to make? In which case, I would accept a motion to move the minutes.
After you, Commissioner.
Thank you. Mr. President, I have a motion to approve the minutes from the regular meeting scheduled September 6th, 2022.
Second.
Perfect. All in favor, say aye.
Aye.
Aye. Opposed? Thank you. Let's move into the informational items. They're in writing, so let me turn it over to Director Hill, though, to run this part of the meeting and see if anybody has any questions or comments.
Okay, I'm going to try and keep out of trouble this time and actually be close enough to the microphone so people can hear me. Again, I'm not going to read my report, just give you a few of the highlights. We completed our first budget for the health department and submitted it. It comes in $500,000 less than Tri-County was costing per year from the general fund of the county due to pretty good results we've had in getting funding from the state. And also we've estimated we're going to make a pretty good fee revenue as well in environmental health and in vital records. So budget has gone to bed, or as soon as the commissioners vote on it, it's gone to bed. We're done with it. We did a town hall last month. I went and spoke at an elected officials reception in Lone Tree. And then I went off to a retreat with the Colorado Association of Local Public Health Officials. So I got to meet more of the public health leaders in the state and find out what they're all up to. So that's going to come in handy in the future. I know people to talk to. And from that, I rolled into Public Health in the Rockies, which is the annual meeting of the Colorado Public Health Association, slightly different organization. Again, good educational stuff and a chance to learn more about Colorado. We're still working with the state. We're still finding little pots of grant money that are going to come our way and figuring out programmatically if we can handle the projects that they entail. So our budget may get even better than it appears right now on paper. Environmental health has really been going gangbusters, even though we're not quite fully staffed with inspectors. We're doing a lot of inspections, and we've actually found a restaurant through some complaints that Tri-County had not inspected for 3 years. So we're making some good progress, I think, on behalf of our community. We're still working on getting our dashboards. Rachel back there is the person responsible for doing all our dashboard work. And we will at some point have everything we know clickable online for the public to find out. So they can ask us if they want, but if they don't want, they'll be able to click around and find it. So good progress still being made, and that's my report for this month.
Thank you. Anybody have any questions?
I don't have any questions, Mr. President, but I do have comments. I took the time to read all of the executive director's report, and I have to say that I am really amazed and pleased at the work, Mike, that you are doing with this health department. One positive comment after another. You talk over and over about working with CDPHE staff, with your staff, getting things done. I just spent 2 days in La Junta at the SEMTEC meeting, which is the State Emergency Medical Trauma and Advisory Council. So there were lots of CDPHE people there. And I thank them for working well with us as we develop our health department. And, they said that they enjoy working with us, that you're doing good work. So I just want to let you know that others are noticing your work. And I think that I've said this before, 5 years from now, we're going to look back and think, why the heck didn't we do this sooner? And that's possible because of your leadership. Thank you.
Thank you.
Give us some context and color around the meetings you were in, the town hall meeting and meeting with elected officials. Any feedback you got? Anything that stood out to you?
Nothing really outstanding. I mean, the town hall, I thought that half of the questions were directed toward what about my taxes and county commissioner issues more so than they were the health department, but we didn't get any questions we couldn't answer. Then early the next morning, I went up to Lone Tree to that elected officials meeting. I talked for, I think, 15 or 20 minutes, and then I took quite a few questions from the elected officials and, asking about, I don't want mean inspectors coming into my restaurant or my coffee shop, and me assuring them that that's not how we're going to roll. I mean, if you are a dirty restaurant that hasn't been inspected by Tri-County in 3 years, we may have some unkind words for you for a while, but our intent is to help everybody do a good job and serve healthy food to the public. Maybe not always healthy food, but serve it in a healthy manner.
Sanitary
safe manner. Sanitary is a good term. But I think it went well. I mean, Commissioner Thomas was there. I don't know if you perceived anything different, but everybody seemed to be nodding their heads in the end.
I agree with you, Mike. I think that you're kind of quiet, and so people were asking you lots of questions. I find that you're humble, that you don't brag a lot. And so through the questions people asked, it really brought out the good work and the programs that you are providing for the county. And once again, I was really pleased to be sitting in the audience listening to your answers. You are just so calm that I have never seen anyone rattle your cage, which I think is really important in your position.
It's a survival skill.
Well, Commissioner Thomas has set the bar we all need to get over now. So I thought that would get a bigger laugh. We will move on. Are there any other questions on any of the other? So we have Administration Division update, EPR and disease surveillance, and environmental health.
And community health on the other
And
side.
pardon me, and Community Health Division. I do have a quick question for the Environmental Health Division with respect to wastewater and on-site wastewater permitting. I guess, can you give us a little update on that? Because, as after our last meeting, there were, I think, 1 or 2 people that had been working with Tri-County that felt that they'd had some difficulties, and it involved, I think, just some logistical bureaucratic issues that they felt like they weren't getting, approvals quickly enough, and they were sort of trying to sell their house. Can you give us an update on that? And were those resolved? Were those valid? And just because I'm sympathetic to people trying to sell their house and maybe running into some issues.
Absolutely. I do think for the most part they've been resolved. We have another one I think that's coming up that's going to be a similar situation where they're getting 2 different inspections with maybe conflicting results. So I've come up with a pretty good plan to help mediate between the inspections and hopefully allow people to get their permit to sell their house quickly. We have tried really hard to provide excellent customer service and getting those use permits out rapidly. I know a few weeks ago we had 2 houses that were closing at 2:30. They sent in their use permit application at 10:30 that morning, and so we hustled to get those issued before both closures happened, which is exciting, and I think that's our opportunity to provide excellent customer service. I will say, as we're training, we are taking maybe a slight bit longer in some cases because I am training 2 people on 77 permits a month. And so sometimes it's taking a little bit longer. But I know as we continue learning and progressing and we have our staff fully trained, we'll be able to exceed the standards that Tri-County set.
No, I have no doubt that you will, and that is extraordinary public service. And I would say above and beyond the call of duty, that if there's a closing at 2:30 and they call you at 10:30 and you manage to do it, so thank you.
Yeah.
That's really great, and that certainly, again, is above and beyond the call of duty. Yeah, I mean, obviously what we want is an accurate inspection done so that people understand what they're buying, and so the seller, the seller is confident in what they're selling, and people are confident in what they're buying.
Yes, absolutely. I will mention that we have an opportunity for sellers to sell their house and septic system as is. And so we do have a document that they can sign, that the purchasers can sign, saying, I agree to make the repairs necessary to this septic system if somebody is really hoping to sell their house as is. So we have that caveat, and that's helped us to get some use permits out a lot faster.
Okay. Thank you.
Yes, thank you.
Appreciate it. Any other comments? Okay. Let me pause for a moment here because these are also public documents, and just see if they're on this portion of the agenda, if there's any public comment. Any comment? Anybody comment in the room? Troy, is there anybody online that would like to comment on this portion of the agenda?
President. Thank you, Mr. President. I have no online comment.
Okay. Wonderful. Well, let's move on to our action item then. This is an action item we discussed at our last Board of Health meeting, that we wanted to rescind the public health order that we had issued at one of our initial meetings last year, and we wanted to then reissue sort of some guidelines so that if we needed to, so a public health order needed to be reissued, one, to ensure that Michael, as he statutorily does, has the authority he needs to act quickly in the event that we need to act quickly. But also, we want to make sure that the Board of Health, and particularly the elected officials, are brought into that decision-making process for a couple of reasons. One, they're elected officials, and we're an appointed board also that should have some input into public health orders. And two, I think that it provides some reassurance and some, frankly, credibility if you take action, if the public health director takes action and then the board adopts it. Because the board is, particularly the commissioners, are going to be the ones out there working with the community and talking to the community. And if the public sees us, and by extension them, take action, I think that provides some assurance that what's being done is being reviewed, and it is being approved by the highest ranking officials in the county with respect to public health issues. We put together this, and Mr. Pratt did an excellent job of putting together the public health order, and I would, with that background, I would like to see if any of my colleagues have any comments on it. And another reason, frankly, to do it is we're out of the pandemic. The pandemic's done and it's over. And it's time for us to, I think, move on. And it's time for us to, acknowledge that. And I think one of the ways to acknowledge that officially is to rescind the public health order and move on. So with that, I would like to see if any of my colleagues have any comment on the order, any revisions to it. And we will put it to a vote tonight and see how it goes. Commissioner Thomas.
Yes, Mr. President, thank you. So when I read this, I think it is well done. I appreciate the information on what it is accomplishing or trying to accomplish. My only question is about in items 2 and 3 where it talks about a 60-day time frame. And the only reason I bring that up is that when the legislature tried to pass some legislation to limit the governor's orders. As I recall, it gave the governor 30 days for executive order power before he or she needed to bring it back to the legislature for them to ratify and continue those public health orders. And this says 60 days. So I'm wondering if we could have some conversation, and I'm interested, Mr. President, because of your expertise in this field, why 60 days is what was chosen.
Thank you. So I think the 60 days, and I'm open to making it shorter, most certainly. I think the 60-day period anticipates Board of Health meetings becoming less frequent, and that we would do this under a normal Board of Health schedule. I am personally not wed to 60 days. I think, if it were important enough, I think the board could meet in special session very quickly. But I think it was with the idea that we could meet at our next public meeting and do it. But I'm not wed to, it was a number that was picked, I think, with that idea in mind. I'm not wed to, certainly not wed to 60 days, and would consider it a friendly amendment if people wanted to adjust the time period.
And Mr. President, I'm certainly open to the 60 days if that's what you and the director recommend. I'm just bringing this up for a conversation point.
Sure. And Commissioner Teal.
The key word in that sentence here was within. And I think the importance, when I read this, I wasn't so much concerned in terms of on day number 59, we would call a public health, Board of Health meeting, as much as, it is within. I don't know, I try to be a student of history. A lot of what we do in this country with boards of health is to convene when there is, a public health emergency of the effect where, people are dying in the street kind of thing, and where we may not have the ability to transmit to the public the risk factors associated with public health. So, I think the point made by the commissioner is sound in that why 60 days instead of 30 days. I'm cognizant of the fact that, Director Hill may be busy for 2-3 weeks, actually, doing the work to mitigate the public health emergency. And so, the whole team would be here, literally probably working 24/7 in the most drastic instance. So, I guess I didn't, the within 60 days doesn't mean, to me, it would mean that our direction to the public health director would not be, don't wait till day 59. Try to get us in within that 30-day window. Actually, if it's really bad, I personally would appreciate having the opportunity to meet up as an entire board within that first week. But I think we do have to have a realization that the whole public health team might be really busy in that interim time. With all that said, I guess I'm willing to go with where the balance of the board is in terms of, does it have to be within 60 days? Should it be within 45? Should it be within 30? Should it be within 15 days? I don't know. I think I'd be willing to hear from the rest of the board and see where they sit on that one.
So I'm thinking this through. If there's, let's say a slow-moving public health issue like COVID, that's on one end of the spectrum. As I was thinking through what could potentially happen. I remember, there's, let's say, a wildfire. And there is there's an air quality impact from that. We had that, I remember, back in, and you may remember, Commissioner Thomas, back in I think it was 2000, it would have been about 2002, I think, 2001, 2002, where actually there was it was a serious issue in Denver where you really couldn't see. It was, I don't know if you all remember that, there was a lot of PM floating around. And that was an issue, and I was thinking, well, if we had something like that here, let's say it wasn't that magnitude, it was impacting a certain area of Douglas County where there was an air quality issue because of smoke and particulate matter, that, Michael would have the ability to, issue a public health order for, to take whatever action would be necessary at that time. We may convene, or he may call all of us and say, here's what's going on, here's what I'm going to do, here's the public health order I'm going to take. I don't think I need much more from you guys other than what we've done here. Then, we either could affirm it when we next meet, or in the alternative, the public health, issue could resolve itself. In this case, the fire's out, the air clears up, and it just expires of its own weight. So whether it's, the time period doesn't particularly worry me. I was more thinking on the front end, making sure that there is an ability, like the clear stated ability. I think the statute gives it to him, but I think that we should recognize the statute that Michael can issue the order, but that the order is going to be subject to review, which I think is an appropriate sort of check that this board needs to have moving forward, and that we have the ability to rescind the order at any time that it's opened up. And there are questions, so let me go in order. I think, Doctor, you were next, and then, Michael, you had something to say, then Commissioner Teal, you were up.
Thank you very much. My concern about it is not the time period of us meeting, because I think in this day, unless there's a major disaster that kills the internet, we can meet relatively quickly. But my concern is how this fits in the broader cycle of renewal, because when we meet, are we going to routinely then renew for 2 months? For 60 days? Are we going to renew for 30 days? Are we going to renew for a year? So I would like to have some consistency about that pattern.
Well, I think we could do what we did in the initial public health order, which is renew it and then put whatever time period we think is appropriate on it. That would be my feeling. Mm-hmm. Director Hill.
Yeah, so just one comment on why the 60 days is in there is, if something happens like the internet does go down and it takes me 59 and a half days to get a hold of you all to corral you into a room, that we haven't violated anything, so that it's not like I'm going to issue a public health order and then just sit on it. I'm going to be trying to get it approved as quickly as possible. But that's the reason, is if some disaster makes it difficult to bring together a quorum of the Board of Health, we want to give ourselves some elbow room in there.
Well, and I'm not prepared to quote chapter and verse from our bylaws right this moment, but one of the remedies to this in terms of making sure that the board can meet within a timely manner after a public health order is issued by the director would be the criteria whereby the Board of Health can be called by its members.
Right.
And again, I apologize. I don't know if I'm mixing up our bylaws with the Castle Rock Town Charter. But, in Castle Rock, the mayor can call an emergency meeting himself, herself, or 2 members of the the town council can call a council meeting.
Right.
Maybe this is something that we can ask of Mr. Pratt to clarify if we have that provision in the bylaws, and then if not, perhaps that's a topic that we do take up at our next meeting, of making sure we have an amendment to the bylaws to ensure that we have a health director who is busy fighting the fight, fighting the battle on whatever emergency does come up. But then we, as individual members, or you, Mr. President, have the capability of calling the Board of Health, so that, we don't have to worry about getting to day 59 as you're trying to track us down in a non-internet age. I do see Mr. Pratt has his folder open. He may be ready to add clarity to my thought.
Thank you, Commissioner. I certainly can. Chris Pratt with the County Attorney's Office. Your bylaws currently read, a special meeting of the Board of Health may be called by the President, the Director, or a majority of the Board of Health, which would be 3 of you, at any time with at least 3 days prior notice, or in the case of an emergency, on 24 hours notice, by telephone or email to the Board of Health.
Okay. Well, I would submit that it's in our own bylaws to have a mitigating factor on the length of that 60 days.
Right. Yeah. No, I think that's right. And it's a practical matter. I mean, if there is a serious issue, well, if we have a big, smallpox outbreak, something that happens, you're going to start issuing public health orders in order to get the problem fixed. That's the first thing you're going to do, I presume, to start addressing the issue. Maybe not fix it, but address the issue. Then you're going to call, I assume, me, and you're going to say, we need a Board of Health meeting. And then we're going to call a Board of Health meeting within that 24-hour time period. Actually, now that I hear it, the 24-hour time period makes me a little bit nervous. We may want to call a meeting within a matter of hours, and so I assume we can waive the bylaws if we needed to, because hopefully it never comes to that, but we would waive the bylaws and we would meet in a matter of hours, and Michael would brief us on what's happening, the steps he's taken, and then we would approve, whatever public health order that he put out there. Now, in the event of, there's a wildfire, and he says, I need a public health order, to do this, then he calls me, and then I think we communicate with the board in a more informal way, say, this is what Michael's doing. Does anybody think that we need to meet over this? Assuming the answer was no, then we would just wait till our next meeting to either approve or rescind the public health order because it's not necessary. Does that make sense? Mr. Parrott?
Is there such a thing as a virtual meeting to do that?
Yes.
Okay.
Yes. We can certainly meet virtually to do that, and that, depending on the circumstances, may be where we end up.
Okay.
For me, looking back on the last couple of years, I think the most important element in paragraph 2, for me, Director Hill, you're proving to be absolutely excellent at your job, but having the capability to have that control factor that the director can issue a public health order, but it expires after 60 days if not ratified by the Board of Health, I think is, in my mind, looking back in the last couple of years, extremely important. I mean, the people of Douglas County must have the ability to communicate with the Board of Health members, maybe help level set on their perception of the severity of that compels the director to call that public health order. I still feel like I still get comments to where that was something really lacking in the COVID emergency response that I think we all experienced.
It's a really, really good point. And you're right. I mean, we would have a public meeting to talk about this, and then the public can come and share their thoughts on the order. Are there any other comments or any suggestions? Mike, Director Hill, anything else you have to add to all of this? Is it consistent? How was it handled like in your previous positions? How was something like this handled?
Well, there's different kinds of orders that a public health officer could issue. I mean, in Illinois, I could issue orders of quarantine or isolation, and those had to be ratified by a judge within 72 hours. Broader public health orders, there really wasn't an envisioning of a review process, because the thought, I think, being that if it was that serious that you had to issue a community-wide order, then everybody would know what the problem is and understand. So this whole, frequent and overlapping and conflicting public health order issue is kind of a new wrinkle in public health. These public health orders have been used very sparingly over time until the last 2 or 3 years during the pandemic. So, I mean, I'm fine with, I right now have the authority to issue a public health order, but if you want to put parameters around that, you employ me, so feel free.
Well, I think you make a good point. The goal of the parameters, or the purpose of the parameters, is to address what you just brought up, which is that there has been a lot of attention paid to this over the last 2.5 years, and not all of it positive on public health. And the idea is that we would, if we find ourselves in a similar situation, we would subject ourselves to public comment, on the order itself, and the public would know that we have the ability to affirm or rescind the order, and the burden then rests with this board to do that after hearing public comment. And I think that's an important element of this order, which is to take accountability after hearing public input. Yes, sir. Oh, I'm sorry, Doctor.
Yes.
Doctor.
I was reading through this. I do have one a procedural or structural concern with the document. And it looks like we're covering two things in one document. Would this be better that we basically go through the first part of it and say that we're rescinding the earlier order, but put the part about the director and the meetings in a separate document and put that as a policy for us? Because this seems like you're trying to do two things which might be unrelated in one document. I do not have any objections to what is in the document itself, except for the fact that every time somebody pulls this up to look at it, they're going to be looking at the original rescinding of that public health order. So maybe it would be better if they were separate.
Any comments on that? So, a couple of ways we could go here. First, let's want to see if anybody has any thoughts on that. I just, procedurally, you could make a motion to amend the order, bifurcate it, and help me out if my procedure here goes wonky. You could make a motion to bifurcate the order, take provision 1, make it its own, resolution, and have that as an amendment, vote on that, and then vote on the second. I don't know how, I'm thinking through the implications of that, but hence my filibustering by explaining how it could be done. But I would be interested in anybody else's thoughts on that.
Thank you, Mr. President. I'm actually interested in what our legal authority would recommend. Thank you, Dr. Fielding, for bringing this forward.
I think you have broad discretion in this matter. This is a procedural matter that you have discretion to decide to do how you would like. There are several ways this could be handled. I do think it would still be valid as is if approved by you. If you choose, you could bifurcate it. I believe the simplest procedure for that would probably be simply a motion approving and asking that it be bifurcated in two separate documents before it's signed.
No.
That would probably be the simplest procedural way to accomplish what you want. But again, I think you have discretion. You don't have to do that. It's up to you.
I'm okay with that. I mean, I think the point is sound. One is sort of ongoing procedural. One is actually ending a past public health order. So I'm okay with what was proposed by board counsel to bifurcate in the method that he talked about.
Is any, well, let's leave that out there. Keep in mind the motion you need to make. We should be going to public comment now, unless there's any other board comment on this. We'll see if there's any, maybe we'll be informed by public comment on it.
Okay. And then I'll make a motion.
Yes, then, and then we can make sure that you make the correct motion. Is there anybody in the room that would like to make, we have two. We have, Mr. Fielding, if you would introduce yourself and the town that you come from, and then ma'am, you'll be next.
Thank you, Mr. President. First of all, with regard to the motion that Dr. Fielding made, I think I would prefer to see the bifurcation. I think it might be clearer if someone, for example, were wanting to consult the records and they were looking for this. As to the whole idea, I will reiterate my comments at the last meeting with regard to President Benevento's comments about the pandemic being over. Personally, I am entirely in sympathy with those comments, but I don't think that Douglas County should be the first county in the state to be saying that. We already know that much of the mainstream media is hostile to this board. It blames Douglas County for the demise. Organs like the Denver Post blame Douglas County for the demise of Tri-County Health. And my concern is that if it turns out that we have a bad flu season later on, that Douglas County's premature declaration that the pandemic is over could come back to haunt this board and to vitiate this board's public credibility, and to give people who already are not well disposed toward this board an additional stick with which to beat this board and its members. And I would not like, I think that the idea that the pandemic is over, I think I'm strongly in favor of that, but I think it is premature for this board to be saying that publicly. We should wait, I think, until we are further along in the winter and see what the flu season in Colorado really is like. Thank you.
Thank you. You would provide your name to us and the town that you live in.
I'm John Fielding from the Pioneer.
Thank you.
Hello, board members. My name is Fran Santagata from the Roxborough community, and I wanted to thank Dr. Fielding for her suggestion, because as a member of the public, reading that resolution, I was confused. It does look like they're two separate things that are trying to be accomplished, and it wasn't clear to me reading it what it was that we were doing, because they really, in my mind, they should be separate. And I don't see this as, when they're bifurcated, the second piece of it, as stating that the pandemic is over. It is just simply talking about the measures that we took as Douglas County in response to the pandemic, those are in fact done. We're not doing that anymore. So I think it clarifies cleanly that yes, we've recognized that we're not doing this anymore, and now we've put that, into, we've codified it. Secondly, I just wanted to mention about the 60-day time frame. Public health emergencies are so different than anything else. I remember back when we were dealing with the anthrax attacks, I was part of that back in 2001, and that was such a difficult public health incident to get your arms around and to figure out what was going on, the investigation, and then the measures afterwards. So I don't think it's unreasonable to look at it with the 60-day time frame, knowing that this board, you guys are on top of it, Mr. Hill's right on top of things, but giving yourself that extra leeway in case something does take a little bit longer than you would have anticipated to come up with a plan moving forward, because it's not clear what's happening. That's all I have. Thank you.
Thank you. Troy, do we have is there anybody else in the room that would like to make a comment? Troy, is there anybody online that would like to make a comment?
Thank you, Mr. President. I have no online comment.
Okay.
I have one.
Mr. Parrott.
I have one comment, and that is, I want to challenge this notion that, quote, the pandemic is over. And the reason I say that is that in spite of what President Biden has said, the CDC is still recommending that people like me get another booster shot, which I'm scheduled to get next week. And if there's not an issue with COVID being out there, why do I need another booster shot? So I don't think it's all that clear, at least in my mind, that it's all over with.
Commissioner Teal.
I mean, these are good points all. I think for me, it comes down to the fact that, we are all going to see ads and public service announcements advising us to go out and get flu shots. And yet the Spanish flu, I don't think anyone would say is still underway. The Spanish flu pandemic was essentially over with. I don't know, I might need to ask for a little professional help. I phone a friend on this one, but at least since 1921. And so I think the conversation where it draws my mind is actually probably having an ongoing COVID policy, an ongoing COVID posture here in the county, and perhaps in our country, and perhaps around the world, to reflect that, we all saw Mayor Pro Tem Bracken in my seat at the last meeting because I had COVID. I wanted to stay in bed for a week. And so it's still something ongoing, but it's very much like, just as the Spanish flu caused this country to take on the vaccination effort for the flu virus, the Spanish flu is no longer, it's not ongoing. So really, it kind of calls for us to have, perhaps, as Mr. Fielding suggested, not a declaration of the pandemic being over, but at least a recognition of a ongoing COVID policy, an ongoing COVID posture, an ongoing COVID. I really don't know. I guess I'm struggling for the correct phrase.
There's a difference between COVID and the pandemic. The pandemic's over. I understand that, folks may not, for whatever reasons, want to say it. I'm going to say it. The pandemic's over. I think pandemic is a legally defined term. I don't think we're seeing the numbers that would justify us calling it a pandemic anymore. And I think if folks in our position can't say things like the pandemic is over when the pandemic is over, then hey, there's probably a question about whether we need this board or not. Now, COVID's not over. COVID's around. COVID's going to continue to be around, and I think that's acknowledged as well. I think what I'm saying when I suggested this was that we should be taking steps that bring us to the point of a post-pandemic world, which I think everybody's eager to get to. And what doesn't diminish that there are still communicable diseases out there, COVID being among them, but what it does is provide I think the information to the public in a straightforward way that we are in a post-pandemic world. Dr. Fielding.
Yes, if I may be a nitpicker again, and I apologize in advance. This resolution does not say a thing about the COVID pandemic being over. All it is saying that we had given the schools an exemption from an existing public health condition, and now we're no longer enforcing it. Right. So much of the discussion is irrelevant to this document.
I don't disagree with that at all. The purpose of that document, though, was to reflect what was happening with the pandemic. Yes. So now but I think you make a good point. Commissioner Thomas.
Yes, I agree with the reasoning you just gave President Benevento about the pandemic being over. And I even think I remember seeing President Biden announce that the pandemic was over recently as well.
That caught my attention as well, so yes. Director Hill, you look like you're dying to say something.
I'm dying too, but I probably shouldn't say it. There's only one person in the world who can declare the pandemic over. That's Dr. Tedros at the World Health Organization, because pandemic implies that it's a world problem. So Dr. Tedros declared the pandemic, and only Dr. Tedros can declare the pandemic over. So our active response and hyperactivity related to the pandemic might be over, but the pandemic's not over till Dr. Tedros says it is.
Right. Well, but our response to how we respond to that is up to how we respond within the county is up to us. So we're still allowed to have our opinion with respect to his, and I'm not knocking the World Health Organization. Others have done that. I have great respect for public health, but as far as I'm concerned, within the borders of Douglas County, we're good.
We're over it.
Yes, we're done. Yes.
President Benevento, as we get closer to making some motions here, I would just like to state for the record that I appreciate the conversation about my comment about 30 days versus 60 days, and I am comfortable with 60 days.
Thank you.
Are you ready for me?
I am ready for you, Dr. Fielding.
I would move that we vote on this combined resolution with the provision that it be separated into two separate resolutions, one of which to go through to number 1, and the second to include numbers 2 and 3 as a separate resolution.
I will second under the provision that the mover clarifies that it is with the approval of the contents of the resolution and the bifurcation.
I accept that friendly amendment.
And then my second is there.
All right, we have a motion, we have a second. All in favor, say aye.
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 Opposed? Excellent. And the next item on the agenda is citizen comments. Are there any citizen comments, additional citizen comments? Nothing from the audience? Troy, is there anybody online?
Thank you, Mr. President. Again, no online comments.
Excellent. Okay, with that, I would take a motion, I will do, I'll motion to adjourn the board. Do I have a second?
Second.
And all in favor of adjourning, say aye.
Aye.
Aye. Opposed? All right, we stand adjourned.
Thank you. Thank you. That was